So welcome back. Now in 1816, Dr. Leineck invents the stethoscope to better hear the lungs of his patients. And within a few years, he becomes very successful. He actually becomes the personal physician to a royal family member. And within 10 years, if a doctor did not have a stethoscope, they weren't considered a good doctor. And to this day, if a healthcare professional doesn't have a stethoscope, they sometimes are not considered a healthcare professional. The stethoscope is very nice because it helps us listen to the lungs, specifically the air that's moving in and out of the lungs, to pick up any disease. And one of the diseases that are in the lungs are lung infections that can be caused by, as we already learned, viruses, bacteria, and other things, but mostly viruses and bacteria. Because lung infections are caused by different things, they have to be treated differently. In the case of bacteria, they're treated with antibiotics. The way antibiotics help control infections in the lungs caused by bacteria is they will either ruin the covering of the bacteria itself, or if they will block an enzyme, or in some cases they will disturb the machinery that's essential for the bacteria to survive. So if the antibiotic is overused or it's used the wrong way, it can lead to antibiotic resistance. This is where the bacteria mutates enough or it changes enough so that it can bypass the deadly effects of the antibiotic. So let's take the example of a human body, and let's say it has 100 bacteria in it. They're all the same type, but they're different colors. So let's say 80 of these bacteria are colored green. And so they are very sensitive, meaning that they are very easily killed with any antibiotic. 15 of these bacteria are blue in color, and so they're a little bit harder to kill, but they're still sensitive. And then there are 5 reds, and these are very resistant. They cannot be killed with the antibiotic alone. They need a little bit more help. So what happens when this bacterial infection, let's say it's causing a medium lung infection, gets a medium antibiotic? Well, the antibiotic will start to kill off the greens and it'll start to kill off the blues, and now the immune system has kicked in and it will finish the job. Now, what happens if this same body, the bacteria was just sitting there? It really wasn't the cause of the problem. The lung infection was actually caused by a virus, and now it gets an antibiotic. Well, again, the medication will kill off the greens and it'll start on the blues, but it's not getting the help that it needs from the immune system to kill off the rest. And in this case, the remaining bacteria will quickly mutate to blues and reds because they've learned that this is how they can survive. So now you've taken a medium bacterial infection and turned it into a stronger one. Now, what happens in this same body if a broad spectrum antibiotic is used? Let's say an antibiotic that is way too strong for the infection that is there. In this case, the antibiotic quickly kills off the greens and the blues, and the few reds, they quickly learn that they're not going to survive, so all the bacteria will quickly turn to red. It'll mutate, and now it becomes a deadly infection for others. This is what happens in the case of those superbugs, those multi-drug resistant organisms, because the bacteria are mutating because too strong of an antibiotic is being used for the infection that is there, and then it becomes more deadly for everyone. Now, let's say the body doesn't like to finish the antibiotic course. So let's say on day 4, the body feels better. So the antibiotics are in the body, they have killed maybe most of the greens, but the body felt better, stopped taking them. Now what happens? Well, the remaining bacteria will mutate to blues and reds and maybe a few greens. So now again, you've taken an infection that probably wasn't very strong to begin with and made it stronger as a result of its exposure to an antibiotic that wasn't completely finished. So this problem of antibiotic resistance is huge. It's everywhere. It's getting worse day by day, and it's deadly. And how, as humans, can we even survive this? Well, the first thing is to try to make sure if antibiotics are really needed for an infection. So before treating an infection, don't be quick to grab those antibiotics. See if it's really a bacterial infection that would benefit from it. Number 2, try not to use too strong an antibiotic for every infection. Ask the advice of your healthcare provider. And then number 3, really fight that urge to quit taking the antibiotic when you feel better. Because even though you feel better on the outside, that antibiotic is still doing some good on the inside. And hopefully, by working together, we can hopefully make this problem a little less. As Jin Erso said, rebellions are built on hope. Until next time.